Monkeypox, it's a virus that's been around for a while. It's an infection I have never seen as an infectious disease doctor. It doesn't mean that I need to know about it. And that applies to a lot of physicians. You need to recognize monkeypox, think about what types of patients we're seeing it in now, how it presents, how to test them, and then how to care for your patient. Most people who have monkeypox do not need to be admitted to the hospital. And any monkeypox patient should be able to be evaluated in a doctor's office.
So I know a lot of people are asking about the vaccine, which is pretty limited at this point. Are people eligible to get it in Ohio, and where can they get it, and who should get it?
Yeah, there are two. Well, officially speaking, there is no vaccine that's FDA approved for monkeypox.
Oh,
There are two smallpox vaccines that do have great activity in helping protect somebody from monkeypox. The first vaccine is the good old-fashioned smallpox vaccine. In our country, we stopped doing this in 1972. This is not a fun vaccine to get. This vaccine, you can't give it to people who have skin conditions. You can't give it to anybody who has a weakened immune system. And that's really not the best vaccine to get, in my opinion. There is another vaccine out there that's a shot, but it's better tolerated. It works pretty good. Unfortunately, there is only one factory in the world in Europe that makes this vaccine called Junios. That is the vaccine that's in worldwide demand right now. In the month of August, there was manufacturing problems with this vaccine, and there supposedly is some vaccine over there that needs to be inspected by the FDA. Nonetheless, in a perfect world, we would like to preventatively give the monkeypox vaccine out to anybody who is at risk of getting it. That's not the capacity right now. So nationally, with a limited supply that we have, the priority is to do ring vaccination. What that means is if somebody has had a proven exposure to somebody with monkeypox, those people will be prioritized to get the vaccine to prevent them from getting monkeypox. What we're seeing now in a very limited capacity is the CDC, the federal government, is releasing a small amount of supply to states that have a lot of monkeypox activity, relatively so compared to Ohio. So far, Ohio has only had 8 confirmed cases. That's a drop in the bucket compared to like New York, Southern Florida, Washington, D.C., Chicago, the West Coast areas. So in those areas, they are giving a very limited supply of the vaccine to give to at-risk communities. Guess what? In New York City, they got a small amount of vaccine and they went through that super quick. And there were a lot of disappointed people who wanted to go to the health department to get the vaccine preventatively that were unable to. I could tell you, as an infectious disease physician, I've had many people in Ohio reach out to me inquiring on how they can get the monkeypox vaccine preventatively ahead of time. And right now, that's not an option in the state of Ohio.
okay. So, how can people best protect themselves if the vaccine isn't available to them here in Central Ohio?
So I think people need to keep an eye on the epidemiology of monkeypox. And what that really means is what communities are seeing it mostly. And that's a moving discussion. When monkeypox first came on the scene in Europe, it was predominantly seen in men who have sex with men. And indeed, that is the case now in the United States. I think that's very likely going to change. In Europe, we are seeing monkeypox now in children and in women, but mostly in this country, we are seeing monkeypox in men who have sex with men. Compared to the other viruses out there, COVID, monkeypox is nowhere near as contagious or transmissible as COVID-19. You really need to have prolonged, intimate contact with somebody. The main way this is spread is through people who have the lesions on their skin and you have prolonged, intimate contact with somebody, or you have prolonged intimate contact with somebody where they're face to face in front of you and their droplets or spit get on you.
Yeah, so it's
Uh,
not, and I know there's a misconception out there that is an STI, and that's not the case.
No, it's not a classic sexually transmitted infection like gonorrhea or genital herpes. To say monkeypox is a sexually transmitted infection is basically saying something like MRSA or a skin infection is a sexually transmitted infection. MRSA is a bacteria on your skin, and you can get it on your skin by having close, intimate contact with other people, like wrestlers.
Mhm.
So you really need to have close, intimate contact. One other thing too that's important to recognize, Christine, this virus is a very hardy virus, and the virus can stay infectious on things like clothing or linens or towels. So people who have monkeypox really need to not share bedding, towels, or clothing with other people. You can get monkeypox that way, and people who have monkeypox need to isolate themselves. They need to keep their skin lesions covered when they're around other people until they are completely healed. They should not have contact with any animals, including their pets, their cattle, or wild animals. In nature in Africa, it's believed this virus lives in rodents, and we know that this virus can spread to other mammals, like things like prairie dogs, and even potentially like our domestic animals.
Okay. So can you tell us a little bit about what it presents like on the skin, what it feels like, how long it lasts, all of those kinds of
Yeah.
tangible
So,
things?
so after a high risk exposure, the incubation period, meaning the time from somebody gets infection to the time they have symptoms, can be up to 21 days. That's the range. However, most people who get monkeypox will begin having symptoms within 5 to 10 days after exposure. Not all, but most people will have a prodrome or a viral syndrome, which is many like any other viral syndrome. They can have a fever, headache, muscle aches and pains. One thing that's very distinguishing that we're seeing more with monkeypox is people will have enlarged glands in their groin and their neck area. So after they get that prodrome, within 2 to 5 days, people will begin having skin lesions. Now, there's the classic monkeypox skin lesions that can look like bubbles. They could scab over, they could fill with pus. That's classic monkeypox. What we're seeing now with monkeypox are very atypical presentations. Not everybody has a fever. Some people will just have skin lesions. And some of the skin lesions that appear look like pimples. They look like bug bites. They look like common skin infections that people can get. Also, too, with what we're seeing, many people will have lesions in their genital or anal area. And oftentimes those people will present being evaluated for sexually transmitted infections.
Mhm.
Those people still need to be evaluated for sexually transmitted infections. Based on data coming out of the United Kingdom, about 1/4 of people who have monkeypox also have a sexually transmitted infection. And if somebody you see who does have a sexually transmitted infection, they still need to be tested, and you still need to think about monkeypox.
Okay. All right. So if we could just kind of summarize, what does the general public need to know? Is this something that needs to be top of mind whenever they're interacting with the public on a daily basis? Or is it just kind of something that watch and see for the general
Yeah,
public?
it's kind of a watch and see. I think it really depends on what your community is. For the general public, I'd say this: monkeypox is out there. It's nowhere near as transmissible as COVID-19, and you really need to have prolonged intimate contact with somebody who has monkeypox. You cannot get monkeypox by casually walking by somebody at the grocery store. I think we need to pay attention to the community monkeypox is in. Right now in the United States, the vast majority of monkeypox is in the men who have sex with men community. And we really need to take that message to that community. Monkeypox is out there. You really have to be cognizant of people in your social circles. You need to be cognizant of people you're intimate with. And you really need to advocate for yourself to get tested or evaluated if you have any skin lesions. I am hopeful that sometime towards the end of the year, if not sooner, we will have more widespread availability of the prevention vaccine for monkeypox for anybody who really wants it. But we're not there yet in that regards.